Many people have reflux, call it acid reflux, heartburn. Some people present with actual food coming up. Very common source of cough. A lot of ENT symptoms are related to reflux, chronic sinusitis, even seasonal allergies. So it's a very common problem that can present in a lot of different ways. While we talk about reflux being kind of a lifestyle inhibitor, a chronic nuisance, it actually can lead to serious disease such as esophageal cancer. Almost all esophageal cancers today are reflux oriented or originate as a result of reflux. So it is a very serious problem. It's not just a nuisance. In the area where our esophagus, our swallowing tube, connects to the stomach, there's a valve there. But that valve has to be a two-way valve, so we can burp or let off excess pressure in our stomach. So some reflux is normal. Reflux becomes a disease when it causes pain chronically, when it causes other diseases like pneumonia or cough or asthma. 80% of adult onset asthma today is recognized as reflux oriented. So the disease that we call reflux is really a big disease and a source of a lot of problems. A lot of reflux is diet oriented. It's the change in our diet. We're eating more fast food. We're eating higher quantities, higher volumes. So as the stomach distends, that valve that we have, as if you think of where my fingers are coming in as the valve, as the stomach distends, it shortens the valve. And as the valve shortens, it eventually opens and the contents in the stomach are able to come up. So it's volume dependent. It's the quality of what we're eating. For instance, carbonated drinks, a lot of gas in the stomach has to be relieved, and the same phenomena as the stomach distends with gas or carbon dioxide, because that's what carbonated drinks are, that causes reflux. So some people can treat their reflux by changing their diet. And if you can, that's great. But in some cases, the damage to the valve is so bad that it's unraveled and it doesn't come back. And under those circumstances, a relatively simple outpatient surgery will fix the problem. A lot of people ask how much heartburn is normal. And I think the answer is probably very little. If you're having to take some medicine for it, whether it's a Tums or a Rolaids more than once in a blue moon, if you're having to take it every week or every other day, then that's too much heartburn. If you can associate it with, let's say, drinking margaritas and you don't get it unless you're drinking something like that, then that's not pathologic. But if you're getting heartburn from eating normal food frequently, then that's something you should get checked out.